One of the rewards of the We Society podcast is the window it offers into so many hardly discussed dimensions of British life. Today, it's the world of child carers. Nearly 1 million children in the UK find themselves, some as young as 5, having to look after sick or elderly family members. We live among a hidden army of child carers. Perhaps 2 or 3 children in every classroom, in every school, are wrestling with growing up, studying, building friendships, discovering who they are, and all the experiences of childhood, but together with caring for a sick parent, grandparent, or sibling. The philosopher John Rawls said that the test of a just society was that it should not matter into which family you were born, but to be compelled to be a carer in your childhood surely transgresses that principle. Professor Saul Becker is here to discuss the implications of being a young carer. He is the Pro-Vice-Chancellor of the Faculty of Health and Education at Manchester Metropolitan University and is regarded as the world leader in young carers research, policy and practice. He's been studying the world of young carers for over 30 years and is here to impart some of his knowledge to us. I hope a lot more than some. Welcome to the We Society, Saul.
Thank you, Will. Thanks very much.
Now, the We Society podcast, this idiosyncratic name, what was your first thought when we invited you to join us on the We Society podcast?
So when I first heard the We Society phrase, I thought about Margaret Thatcher's "There is no such thing as society," and how much when I was an undergraduate student I deplored that notion that there was no such thing. And I suppose I've been very challenged as an academic, as a researcher, as a social worker, as a campaigner and advocate by that notion of no society or the I society. So when I reflect on my academic journey and my life journey, the notion of the we society has really governed everything that I've done. It's been the guiding principle of my academic life.
Let's cut to the chase. I have to say that I had no conception of the scale of child caring until I read your work. I'm astonished. Just want to set it out for our listeners, just the scale of this and the implications of it.
Sure. So there are around 1 million children under the age of 18 in the United Kingdom who will be providing a fairly heavy level of care within their families. So they're looking after parents, grandparents, siblings, etc., who have an illness, a disability, a mental health problem, addiction, and in most cases, parents or family members have a combination of those different conditions. So we have 1 million children, some as young as 5, looking after, supporting, providing intimate personal care, doing supervision, looking after the household finances, and so on.
Cleaning, cooking.
Everything. All of these things and more. They're doing exactly the same things as adults who are informal, unpaid family carers. And we have just under 6 million of those, according to the census. So there's no difference in what children are doing from what adults are doing as unpaid carers.
There's almost more children carers than there are children in care.
There is. With 1 million, that's certainly much higher than the number of children who are looked after by local authorities. But the interesting thing is that young carers, these children, have not been seen as a core issue for social policy or for government policy or interventions by the local state, whereas other groups of vulnerable children have. So it's taken really 30 years for young carers to become firmly on the agenda now, but there's still so much to be done. So even though we know there's 1 million children, the vast majority of those children are still invisible, unheard, unseen by local authorities, by the systems of our welfare state.
Let's just drill into this a little bit because I think people hearing this will think, of course, if you're consumed by cooking, washing, looking after people kind of who can't look after themselves, it kind of robs you of your childhood. So everyone kind of gets that. But I think you go beyond that. You're saying that there's kind of knock-on psychological issues, capacity to build friendships outside the home, what happens at school. It's a very deep set kind of array of problems start to kind of present themselves to child carers.
Absolutely. So what we know from 30 years of research, both quantitative, qualitative, mixed methods, and now a set of emerging longitudinal studies, is that the consequences of caring during childhood are just not experienced in the here and then, while they're children, but it does have this knock-on effect. So what we know clearly now is that children who are carers, many of whom have educational difficulties at school, they have significant difficulties in the transition from school to college and to university. Many universities are failing young carers who now become students. And then they have difficulty in the transitions to the paid labour market. But they also have psychosocial impairments as well because of their friendship networks are restricted. It's very embarrassing for a child of, say, 12 to bring friends from school home if your parent has severe mental health problems, alcohol or drug misuse, or a combination. There is a serious stigma attached in some of these kinds of situations. So these kids are very invisible and have been profoundly neglected, but worse still, and this is one of the themes of my early writing, they've been punished for caring, because if our institutions like schools and GP surgeries and health clinicians and nurses, etc., don't see that the child is the carer and then, say, in a school, give them a detention for being late or other restrictions when the child has actually done 2 hours of caring before getting to school and will have to do many hours of caring when they get home. Children experience all of this as punishment, and we need to move from a position where children are punished for caring to being supported, recognised for caring. And that's part of the We Society.
Tell me, your own personal biography, you haven't done this all your career, I know. You've been a provost of Sussex University and, but you've landed all the while that you were doing other things. You had this interest in child caring, and that's because you yourself were in this position when you were young.
So I was a young carer as a child. So I started caring for my grandmother who had Parkinson's at the age of 12.
Blimey, that must have been something.
And I actually cared for her through to the point at which I was doing my PhD on poverty at Nottingham University at 24. So there was that period where I was caring. But I was lucky because I got to university and managed to do my degree. And of course, my life since has been
and your
very
mother
good.
And father couldn't step in?
My father didn't really live in the home, really. So my mother did a lot of the caring. I did a lot of the caring. My mother needed breaks. I would take on the caring by myself. I remember some of the tasks were really difficult and have impacted on my own adulthood, my own sense of, being a father, etc. So the task that I found the most problematic and painful was taking my grandmother to the toilet in the middle of the night. So she would call out. I remember, the call for Saul. I would go and help her, get her out of bed, get her to the loo, help her.
How old was she? In her 70s and her 80s?
She was, at that time, she was in her 70s, so, mid-70s, really. So I did a lot of that caring. But it wasn't, Will, the interesting thing is, it wasn't the experience of caring that brought me into my first research study in 1993, which was called Children Who Care Inside the World of Young Carers. That was serendipity. It was just chance that one of my master's students who ran a voluntary sector association said to me, Saul, do you fancy doing some research with us? He explained what it was. We put in a joint bid at that time, and we got the first research project to do a qualitative study, and 54 studies on, I'm still doing it.
54 studies on. Let's just kind of get a sense of this. This is social science, but with a practical application. But let's just kind of how much more do you need to find out than you've already told me in the last 7 or 8 minutes?
So that's a really good question, because I'm often said, Saul, what more is there to know? And I keep on saying, we've only just begun. And there is so much to find out. I've been very lucky because I've drawn on my background as a social policy academic, but I draw on sociology, I draw on psychology, I draw on other disciplines, social work theories, public health theories. So I've been And that's reflected in the privilege I have of running a faculty, which is a faculty of the professions, multidisciplinary. So I've been very lucky not being a uni-disciplinary person.
Right.
As I've done more and more with other disciplinary groups, I find that there's more and more questions that we should be asking. So, some of my advances have been when I've worked with psychologists to develop psychometric instruments in which we can measure the amount of caring that a child does and the different types of caring, and we can measure the positive and negative outcomes of caring through these instruments, which are now being used in at least 20 different countries. So I've gone beyond, if you like, trying to identify and see who these invisible children are, to being able to work with colleagues across the academy, but practitioners and policymakers, to say, what do we have to do to make the lives of young carers better? How can we have a fairer solution for young carers?
Just a brief pause in the conversation to tell you a bit about the Academy of Social Sciences, which is the organisation behind the We Society podcast. The general election may be over, but that's only the beginning for the new government, as it has many pressing challenges to sort out. From education to the economy, every aspect of our society is crying out for fresh ideas and solutions. Social science stands ready to step up to the plate. I'm Will Hutton, the president of the Academy of Social Sciences. We're a national body for academics, practitioners and learned societies in the social sciences. We champion the vital role of social science in our society, from education to government and business. You can find out more about the Academy of Social Sciences work, support us, or read up on our fellows by going to the website acss.org.uk. That's acss.org.uk. Now, back to the conversation. There will be some listeners who'll be thinking, well, that is the price of being in a family. I mean, families throw up. Sometimes they throw up lots of advantages, families, but sometimes, you have to look after the downside. And actually, that's life, and the dice get thrown in a certain way, and you just have to kind of run with it. And I guess you may have felt like that when you were 12 looking after your grandmother in her mid-70s. But, I mean, that's one thought I've got, the kind of moral question. Another thought I've got is actually, and I was interested that you said there were positive dimensions of this as well as negative. So what are the positive dimensions of this?
So the first 10 years of research really pointed out the negatives. And to some extent, if we think about how do we make a social problem become a social issue, become something for government or social policy responses, we needed to point out the negatives. I'm very conscious that that first decade of research was the negatives. But I think what we've also recognised with research in the UK and overseas is that the positives that come out of caring are really important for some children. So you get things like children being very mature, being able to multitask because they're dealing with caring, trying to get to school, and lots of other responsibilities. You get children who are taking on certain types of care responsibilities within the home, which we would describe as care work, and we would remunerate in the market. But those children are learning those skills early, and obviously later on that might hold them in good stead for certain kinds of jobs. But the downside of all of that is that whilst developing some of these skills, there is the cost of their impaired education, the cost of their restricted childhoods, and the medium to longer term impacts of caring into their adulthood. And we're only really beginning to touch on the longer term impacts through longitudinal studies that are being published more recently that show us that caring during a young age does impact on your access to university, does impact on the kinds of jobs and the pay levels that you will get when you go into the labour market, and so on. And it's still such early days. So there is still much to find out.
Is there a gender effect?
There is a gender effect, but gender, and some people, it's really interesting because when I first started researching on young carers, I read a book by Professor Jane Lewis called Daughters Who Care. And in fact, I did a review of this book because when I picked it off the bookshelf, I thought it was going to be about daughters, young daughters who care. I thought it was going to be about young carers. And it wasn't. It was about older daughters who care, in their 40s, 50s, 60s, caring for an older parent, maybe in their 70s or 80s or whatever. And so it took me and my colleagues and others, if you like, to offer a new paradigm to that thinking, which was that it's not just women in their mid to older age. Children are involved. On the gender aspect of children, what we know is that girls are more likely to do longer amounts, heavier amounts of caring, but gender isn't the crucial factor. The crucial factor is family structure, because if there is a boy and it's a mother that needs care and there's no other family member, then the boy will be involved in all the aspects of caregiving that we know that children do. So birth order is important, family structure is important, but the key element that's important is low income, poverty, social exclusion, because in most of the cases that we're talking about, families are reliant on disability and other social security benefits. There isn't spare capacity to buy through the market alternative forms of care to relieve the child from providing care. So gender is important, but it is not, in young carers' world, the key determining factor.
I mean, you're acknowledged as a kind of global go-to person on this. And you yourself, looked after your grandmother. I mean, so you've had first-hand experience, and you practitioner as a social worker. I mean, are there two or three things that you think society at large should and could be doing?
So I think this is a really interesting issue. So let's take the resilience part of that first. I think that it is important to have some elements of adversity and difficulty in your life. If it's so comfortable from birth onwards, you don't learn the need to engage with others for other people's benefits. So I think without some adversity, you could be tempted to become the I society.
Yeah.
So you need connection, you need relationships. Your book talks about the importance of these things. And in a way, young carers are a really interesting challenge to this notion, because at one level, a young carer is an embodiment of the we society, because they are providing care for their family members and sometimes for friends and other people who are more part of a diffused family network.
There's that dimension of the we society, which is absolutely on the button.
Yeah.
The floor below which no one should fall, and so they're doing that.
Yeah.
The other element of the we society is ladders up which one climbs.
Yeah.
And actually being a carer as a child means that you're kind of getting up those ladders becomes harder.
Absolutely. And that's the issue, which is the issue that you talk about fairness, a fair society, and the ladders of opportunity and so on. And the difficulty is that for some, and I think for many young carers, the experiences of caring during childhood either remove the ladders because of just the way origins and destinations, where you start, where you end up. And in some cases, they just make the ladders too difficult to climb. It's just too difficult, too hard. And so you are distracted, or you end up in a job which is a caring profession, low paid, often seen as low status. Whereas, of course, from my background, jobs in the caring sector should be held in great esteem, because people are doing the most difficult tasks of the most intimate levels for our family members, for our citizens. And so, but the interesting thing about the we society and young carers is the young carers embody we society. But then you could argue that the I society fails young carers, because 1 million of them only of which 20% at the most will ever have had an assessment of their own needs or ability to care. So they are the we society, and the I society and the lack of resources, the lack of investment in our health and social services ecosystems means that the vast majority are still ignored, neglected, and having to do these caring responsibilities as we described, and that will have an impact on their ladders out and their ladders up.
Just trusting these numbers. I mean, because one of the things that is revelatory about your work is that revealing the scale of this. I mean, you've been challenging the way in which we identify carers. You've been saying that it shouldn't be the adults that answer the questionnaires; it should be the kids, and developing some sophisticated metrics. I think it would be helpful for listeners if they, you just a word or two on that, and why we should trust the numbers being at this scale.
So the way that the government has tried to identify the numbers of young carers over the last 20, 30 years has been through the national census. So in 2011, 2021, etc., we've had a government estimate of the number of children who are carers.
This would be a casualty if as the government currently plans, the census is abandoned.
It would be I think it would be a tragedy on many levels, not just on the question on carers, to be honest. I think we rely very heavily for social policy planning, for thinking through the challenges, what's around the corner on the census. But I've argued on the carers question, it's unreliable because it relies on an adult, the head of the household, to fill in the form. And I think if you're a disabled adult, a disabled parent, or a parent with severe mental health problems or alcohol or drug misuse, to be able to tick the box that someone in your family is a carer is actually quite difficult to do.
Yeah.
Because you don't know whether by acknowledging that your 12-year-old, your 7-year-old is your carer and is doing 20 or 49 hours of care a week, and some are, you don't know what the implication of that will be. We say that it can't be traced back, but we know that, but not everyone does. So there is a fear of identifying your own children as a carer. And the census data indicates that 2%, about 2% of all children are carers. That's when parents identify their children. I've argued for 20 years that will not adequately identify the number of young carers. So what we designed was a method by which children would be asked directly. But we wouldn't just ask them in a room, are you a carer, blah, blah, blah. We developed a sophisticated psychometric instrument, which the BBC has used twice now, and the last time they used it was in 2018. And they used it with kids in schools, and what they found was that 10% of those children had a significant caregiving role, measured by a particular score on a particular instrument. But what they also found, Will, was that actually 1 in 5 children, that would be 2 million, 1 in 5 children had some caregiving role, okay? But 1 in 10, and that's the 1 million figure that we've discussed, 1 in 10 had a heavy caregiving role. So ask children directly, you will get a different response. And the reason why we can and we should ask children is because children have agency, children have intelligence. We sometimes don't think they do, and sometimes they don't behave as if they do, but we've all been children and we've probably all had similar behaviours. And if you think about the agency of young carers who are providing these kinds of care, these adult-type tasks, which we would pay other people to do and train them to do, we can't say that they're not capable of identifying themselves as a caregiver if we ask them specific questions.
So, I'm slightly wary because I think that you don't every podcast that we do in the We Society podcast series to kind of end up saying we've got to spend more money. But this is clearly an area where the case for some resource is overwhelming. And because so much of the need is very local, it really falls to local government to get involved here, I'm suspecting. Some of the children, presumably, wouldn't object to some care. It's just it becomes kind of overwhelming. I mean, they want some nights off. They need to be able to do their homework, to go and spend time with friends and all of that, and enjoy childhood. And what are your standout policy recommendations?
So most children don't want to give up caring. They want a balance between caring and childhood, school, education, friends, being a bit reckless, doing stuff, all of that kind of thing. They don't want it to be taken away. They want, in most cases, for it to be reduced to a manageable level in which they can enjoy other things that other children enjoy, and they can participate socially, etc., that their health isn't impaired and so on. The resource issue goes without saying. Unfortunately, the social care infrastructure, our healthcare systems require additional resource. But, that's a question that goes beyond my capability of finding a solution to at this moment. What I can say is, though, that to make the lives of young carers better doesn't just require resources. It does require governments saying to local authorities and to the nation, and public support, public opinion, to say that what children do is really important to families, it's really important to society, it is part of our we society, and we need to really value that, and we need to identify children within schools and other settings so that we can identify to support them, to reduce their caring roles wherever possible so they get that better balance. But the other thing that requires no real additional resource is that the professionals like social workers, nurses, psychologists, psychiatrists, all of the children's workforce, etc., need to be much better able to recognise what young carers are, who they are, and to identify them. And that's not a matter of resources. That's a matter of sensitivity. That's a matter of putting your young carers' radar on full blast, really. Because one of the enduring findings from research from multiple countries is that professionals go into families and they see the adult who has a disability, a mental health problem, an addiction or whatever, but they don't see the child is the carer. And that isn't, in my humble view, a matter of resources. That's a matter of training. It's a matter of awareness, of sensitivity, of a whole family approach or view of what's going on. And so we can improve practice with limited resources going in. So it's not just a matter of money. It is about sensitivity, awareness, and making a difference.
Professor Saul-Becker, what a fascinating 30, 40 minutes. I knew when we brainstormed and thought this was an area we should get into, this would be fascinating, and so it's proved. I mean, the scale, the consequences of it, the cleverness with which you've had to devise instruments of measurement about which you've just been talking. Kids don't want to stop caring for people they love, but they don't want their childhoods to be pulled out of kilter. And so, on a We Society podcast, we have to recognise that. Look, it's been great. Thank you for the effort you've made to get to the studio, because I know it was a tough journey, and really appreciate your time, and thank you so much.
Thanks, Will.
Thank you so much for listening to this episode of the We Society podcast. I'm Will Hutton. The episode was produced by Emily Finch and was a whistle-down production for the Academy of Social Sciences. Be sure to subscribe to the We Society on the podcast hosting platform of your choosing so you can be the first to hear new episodes, and go to acss.org.uk to learn more about the Academy of Social Sciences.